the big C, Mr. C, hefty, or as I like to call it, a pet owner's worst nightmare. Hi pet parents, welcome back to my channel. If you're new here, I'm Charlie and I've owned dogs my entire life. I have a degree in animal science and nutrition, decided not to go to vet school to save my sanity, and in today's video, we're talking about cancer in Bernese mountain dogs specifically. I do want to put out a content warning for this video. It may be disturbing to some viewers, especially if you've had a dog with cancer or are currently treating a dog with cancer, so please be advised. But I wanted to come on today and share our story with cancer in our Berners, how we knew something was wrong, how we treated it, and ultimately how we knew when it was time to say goodbye. And at the end, I will offer some resources if you're struggling with pet grief, as well as my advice to Bernese breeders to hopefully prevent cancer rates in the breed from continuing to increase. So just some quick background. According to the AKC, the American Kennel Club, cancer is the leading cause of death in older dogs and is currently the number one cause of death for the Bernese Mountain Dog. And it's the top reason I hear that most people shy away from this breed, their short lifespan and the fact that most of them do succumb to cancer. And honestly, I don't blame people for that at all. According to Cornell University's College of Veterinary Medicine, it's estimated that about 30% of dogs, or 1 in 3, will develop cancer in their lifetime. And in dogs older than 10, that number creeps up to closer to 50%, or 1 in 2. But what is cancer? So cancer is essentially cells that are growing out of control, either by constant splitting or cells that just continue to grow larger and larger. And the technical term for cancer is neuroplasia. If we break that down, neuro means new and plasia means growth. So it's just new growth of cells. And I want to share a story of Odin, who was our very first Bernese that we lost to cancer at just 7.5 years old. And I'm actually filming this on the anniversary of his death, which is June 19th or Juneteenth. Odin was my heart dog. He went everywhere with me, the store, to work. I even took him to the gym. And people in our town knew him by name. And if we didn't show up with him somewhere, people would ask us where he was. My husband and I had made peace with the fact that he was way more popular with friends and family than we were. He was my shadow and my ultimate protector. And he was also fiercely protective of his younger brother, Charlie, and spelled an immediate death sentence for groundhogs. And I don't know if you can tell, but I do wear a necklace with his name on it in the shape of a Bernese mountain dog, and it's one of my absolute favorite pieces of jewelry. And I'll put the link to the Etsy shop in the description below if you're interested in getting one made for your pet. So how did we know that something was wrong? How did we know that he had cancer? Well, in May of 2021, right before Mother's Day, we noticed that Odin wasn't finishing his meals. Now, listen, this dog lived for food and he was an absolute bottomless pit. He once ate 12 pounds of dog food in one sitting. Another time he ate 2 pounds of roast beef, including an entire can of salsa that was in my crock pot on my kitchen counter. And yet another time in one sitting, he ate 3 pounds of ground pork, an entire 8-pack of Martin's potato rolls, and an entire stick of butter. He also survived eating a pound of milk chocolate Wilbur Buds. Those who live in Pennsylvania, you'll know what those are. And after vomiting his guts out all night, the next morning, he went right back to looking for more. So for him to quit on his dinner, we knew something was really, really wrong. We also noticed that he was breathing heavier than normal, and it would take him longer to stop panting and be able to breathe with his mouth closed again. So I took him to the vet and they did a abdominal and a chest x-ray. And when the vet came back, we got the news that no pet parent ever wants to hear. He had cancer and it was in his lungs. That vet told us that there was nothing that we could do for him except to try to keep him comfortable. But this being my child, that answer wasn't good enough for me. So I took him to a new vet in our area who, although he still confirmed the diagnosis, he did offer a small treatment plan that would hopefully give us a little bit more time. We live on a farm, we raise livestock, we know the realities of the situation. So we knew, given the history of the breed having such a short lifespan and the fact that he was already 7.5 and that this is the leading cause of death in the breed, taking him to an oncologist and putting him through all kinds of invasive treatments wasn't going to buy us a whole lot more time. But more importantly, importantly, it wasn't going to give him a good quality of life, however much longer that was. So we started him on LASIK to remove some of the fluid around his heart and his lungs to help him breathe better. And then we also put him on prednisone to decrease the swelling that had been starting in his abdomen. It really was a labor of love because the LASIKs made him drink more, which then made him pee more. And we had to enlist the help of family and friends to let him out during the day while my husband and I worked. And yes, he did have accidents. Yes, it was a lot to clean up, but I don't regret it for a second. Just part of being a responsible pet parent. Unfortunately, things progressed quickly, and within a month of being diagnosed, he lost the ability to use his back legs, and he could barely make it up the stairs without being completely out of breath. So at that point, I told my husband I was making the appointment to have him humanely euthanized. And whatever your opinions are, my first priority is always for the well-being and the quality of life of my animals. Keeping them just around for me, if they are suffering, is not love. Odin had given me and everybody else in his life so much unconditional love and joy that there was no way that I was repaying him for that by letting him just linger on in a state of pain for my sake. And I truly believe that animals will let you know when they're ready to go. He was tired. I could see that in his eyes. And the greatest act of love that I could show him was to allow him to go to rest peacefully. So on June 19th, 2021, Odin was humanely euthanized while I held him in my arms. He's buried on our property, and we visit his grave often, usually with our current burners in tow. Have you ever lost a pet to cancer? Let me know in the comments. This is a safe space for you to share your pet's story and to honor their memories. So what are some of the things that I learned and some of the things that I wish I knew sooner about cancer in dogs? Number one, the signs of cancer are very similar to signs of many other illnesses. Things like depression, lethargy, loss of appetite, weight loss. The only true way to know if it's cancer is to have a vet do x-rays, ultrasounds, or even CT scans in some cases. Number two, I didn't realize how long they can have it without you seeing signs and how quickly it can progress. So the vets told us that Odin probably had cancer in his body for months before we noticed him stop eating. And it took less than a month from the time he was diagnosed until the time that we put him down. So it was extremely quick. But for that, I also am grateful because I know that he did not suffer long. Number three, the most common type of cancer in Bernese mountain dogs is histiocytosis. This is actually an inherited form of cancer, and it typically invades the area around the lungs, lymph nodes, spleen, kidney, and liver. There's currently no known successful treatments for it. And because these types of cells metastasize or grow easily and spread rapidly, surgical removal of the tumor or the affected tissues is not effective. You can try chemotherapy and radiation therapy, depending on if you have a young dog that still has a lot of life ahead of them. And in my research, I found that it's been used with some short-term success, but it's still not a cure. And care is generally limited to providing comfort until euthanasia. Number four, cancer in Bernese mountain dogs is often inherited through their genes. So the mode of inheritance is what they call polygenic, meaning that many different genes are involved. And the disease often appears after a dog has been bred. So without breeders making a conscientious effort to expand the gene pool, it can't be eliminated completely. As Bernese owners, we should report all cases of cancer to the breeder if they're still around and still in business. And then you can also participate in some ongoing research projects, which I'll link down in the video description below, including the Burner Guard Health Studies page. This just helps the Bernese Mountain Dog Association track the statistics and see how things are either improving or not improving within the breed genetics. Number five, people will judge you about how you should treat your dog and when is the right time to say goodbye. And this is probably the hardest part. So my personal belief is that pet owners should always put the quality of life of their pet first, above their own inability or reluctance to let go. Pets give us so much during their life here with us. It's honestly the least we can do as their caretakers and as responsible pet owners to give them the gift of freedom from pain and suffering. As an example, my husband had never had to euthanize a pet before, before. They all had just fortunately gone on their own. And so he wasn't familiar with the process and therefore was very reluctant to have to make the decision. And I totally get that and I respect that. It is excruciatingly difficult to say goodbye to our fur babies, especially when you're the one making that call. My pets are my children, so to have to be the one to say that it's time, you can't even explain how painful and difficult that is unless you've been through it. But once he saw how painless and quick the euthanasia process was, he's since completely changed his mind and now is much more, quote, okay with the process than he was before. And number 6, pet grief is real. It's visceral and it can last a lifetime. Honestly, not a day has gone by since we lost Odin that I don't think about that dog. It's no exaggeration to say that I shed tears for him at least once or twice a month, if not more, particularly this month in June when we lost him. And you know what? That is okay. No one else has to understand it. I don't listen to people who say that pets aren't kids and that we can't miss them as much as we miss human beings, because I know that those people are wrong and probably have never truly loved an animal before. And one of the reasons that losing pets is so painful is because pets do offer us that unconditional love and support, which is something that people in general just don't get from a lot of other places in their lives, if at all. And if you think it would be helpful, I may do another video all about helpful ways that I found to deal with pet grief. So let me know in the comments if that's something that you would find helpful. I know this is a tough topic, but it's one that as pet owners, we do need to discuss. And I think it's healing to actually talk about it and acknowledge it. So if you guys did enjoy this video and want to learn even more about the Bernese Mountain Dog, I do have these other videos here that go into some of the pros and cons of the breed and why this breed may not be right for you and your family. So you can check those videos out right here on the screen. So I'll see you in the next video, and don't forget, dogs are the best.